Good evening, everyone. So this is the Global Physio Academy, Mamta KANSARA. I'm gonna provide you today education regarding the what is the PCE written exam, how to proceed, and what are the first steps like the credentials, and what to prepare for the written exam framework. I can say framework. So it's really informative lectures. And if you have any query, feel free to contact me at the Global Physio Academy. Okay, just a minute. Let me introduce the candidates. Give me a second. Hello, everyone. I'm gonna wait for the few minutes so I can like involve other students as well, and then we will start. Okay. So actually, let me introduce. Meanwhile, this is a seminar regarding the PCE, Physiotherapy Canadian exam, Physiotherapy competence exam for the Canada. What are the steps? What are the steps to uh, proceed further to become a physiotherapist? Okay. And why this lecture is important? Because I want every student must know before leaving their home country that what are the steps they can fulfill in their home country so they can achieve their success in the Canada in very short time. I'm not saying that it is a short time procedure. No, it is a lengthy procedure. But if we are aware about all the procedure in advance, it is really helpful for the students to achieve their goal. Okay. And anyone has any questions, definitely you can ask me easily. You can contact me at the Global Physio Academy at the gmail.com. You have my contact numbers. So this is for this seminar. Now let's begin. Step-to-step guidance. Global Physio Academy, myself, Mamta KANSARA, provide you the idea what are the steps that you can follow to achieve your dream. Okay. So the first question, how to become a physiotherapist in Canada? Okay. Kindly mute everyone so it's easy for us, easy for other student as well. I think through the, yes. Okay, perfect. So the first question is how to become physiotherapist in Canada. That is the first question in your mind, being an internationally physiotherapist. So we all are like those who are not Canadian, pursuing their degree out of the Canada, they are considered as international physiotherapist. Now, these international physiotherapists, when planning to work as a physiotherapist in Canada, they have to go through some procedure. So that is very important to understand. What are they? Okay. First of all, Global Physio Academy, what is Academy for? What I'm working for. So this Academy is providing the written preparation classes. So for physiotherapy competence exam, there are two exams, written exam and the theoretical exam. I am providing the PCE written classes. So this classes is only for the Canadian students. I am also providing NPTE classes. Sorry. Okay. So PCE written classes, that is only for the PCE exam students. NPTE classes are only for the USA, that is a separate. But today this lecture is particularly for the PCE written. These classes are online, recording is generated, and that recording I'm giving access to the students until their first exam. And why this is important to achieve your goal. So what is your goal? That is another question. That if you are planning to enter in Canada, either way, even though student visa or you are going with a work permit or you are going with a permanent residency, that is your status in Canada. But being a physiotherapist, you need physiotherapist license, and that is your occupation point of view. Okay, so both are different. Don't merge both together. Residency, permanent residency, work permit, student visa is the status. Getting your physiotherapy license, it is your occupation, that on that basis you can work as a physiotherapist. And this seminar is particularly give you the idea about PCE credential, that is the first step, and PCE written exam, how to do the written exam preparation. Okay. Any question, anything, if you have any doubt, feel free to ask. So this whole seminar is working for achievement. Make your goal to become a physiotherapist in Canada, and to prepare the goal and to achieve. In between, you have to do the action. And that action is in appropriate direction, in appropriate manner, and timely manner. That is very important. Because if something is you're gonna miss at some portion, for example, right now, if you are in your home country, you are planning to go to Canada, and if you are not doing anything, and you already entered in Canada, then again you have to go with the to and fro about your documentation, about your credentials. But rather, if you know this thing ahead, it is very easy for you guys to done everything in your home country and then prepare yourself whenever you arrive in Canada. Another scenario, students are already in Canada. You are in Canada, we cannot change. So what the next? Do it. So you can do everything in Canada as well, with the help of friends and with the help of the relatives as well. So the thing is, you must know what is the appropriate action to achieve that thing. And now appropriate action, just directly come to the point, what are the actions? Whenever you want to become a physiotherapist in Canada, you have to pass through this process. Credential, which is the most important. Written exam, again, everything is most important. But credential and the written exam, it is throughout Canada, it is generalized. Okay. And clinical exam, it is based on the province. Province means state. If you are in India, we have a different state, like the Gujarat state, Maharashtra state, Madhya Pradesh, like different states we have. Every state has their own exam that is called provisional clinical exam. Okay. But up to your home country, you can do it this two-step credential as well as PCE written exam. Written exam, it is online as well as at the center. Any of the thing you can choose it. But if you are in the home country, you can give the online test and it is also valid. So I'm provide, like, as per my point of view, as long as much as if you can do in your home country, it is more well and good. So if you are achieving your goal right away from your home country, it's easy to mingle with the other countries, adjust with the new countries, and pursue your dream. Every student has sky is the limit. But that unlimited sky is only and only achievable if you are getting physiotherapy license, if you are pursuing your dream in a proper manner, if you are a physiotherapist. Okay, everyone is master in their field, so don't change the field. That is one of the another thing. Now let's discuss this point, credential. So credential is the first most step, compulsory step. Why the credential is important? So credential basically make every student, every internationally, I can say, internationally student to make their status equivalent to Canadian physio. Means what? I am the international student and this is the Canadian student. So to work international student in the Canada, they have to be equal. So what is the procedure for the equivalence? That is the first step is the credential. So credential is the evaluation of your degree, evaluation of your practical hours, evaluation of your communication skill. That is your English communication or the French communication. So evaluation of that skill, evaluation of your ethical knowledge about the Canadian healthcare system, I can say. So this is the basic procedure that you have to go through that. And once you fulfill all these requirements, you get the letter that you are equivalent to the your education is equivalent to Canadian education and good to go with your written exam. So credential is the step to make the international physiotherapist as the equivalent to give the exam with the Canadian physiotherapist. Okay, so this is the first bench that you have to put that step and then go ahead with the further step. And for the written exam preparation, always welcome to Global Physio Academy. I am providing the PCE written guidance classes. What I'm going to cover, I will discuss today in the lecture. But Global Physio work for the PCE written exams. Once you clear the written exam, okay. For the written exam, you have a 3 trial. If you are not successful with the 3 trial at all, you never become a physiotherapist. So for me, always I insist my student that your first trial is your last trial. If you are thinking you have a 3 trial, then and then you are making like, okay, let me see that what the exam is. No, we are not going for our evaluation. We are physiotherapists. But compete with the Canadian environment, Canadian healthcare system, we must aware about the concept. So first trial is your last trial. Prepare yourself with the excellent way that you can achieve your success. Once written exam is done, you become, like if you have a mentor, you are eligible to work as a resident PT. So resident physiotherapist means student clear the PCE written exam. They can work as a resident physiotherapist until their clinical exam depend on the province. If you are in Ontario, if you are in the British Columbia, you have a clinical exam. Alberta, clinical exam. But if you are in Saskatchewan, if you are in Winnipeg, there 1200 hours, if you are working under mentorship as a resident PT, you are eligible to get your registered PT license. There is no clinical exam. So every province, there is a different style of the exam. Ontario, different style of the exam. British Columbia, different style of the exams. So clinical, I'm not going to dig first because your first step to become a resident PT. And for that, I'm helping to the students. Okay. Clinical exam is your last step that you become the registered PT, you get your permanent license. It is different from province to province. And clinical also has a 3 trial. How to contact for your written preparation. So for the written exam preparation, you can follow, you can go with my website www.globalphysioacademy.com. You can email me globalphysioacademy@gmail.com. You can follow me on Instagram. You can follow me on Facebook, where I am putting some advisable things, questions, for few tips. You can follow me on that page as well. If you want to contact me, you have my number, Canadian number, what is the 416-879-1986. Indian numbers with the plus 915791, sorry, 91578 4884946. That is the Indian numbers. So you can contact me any of the number for your PCE written exam preparation. This is my website, so you can go through that one. You can get the idea about the written preparation and all. Now today's topic, what is credential? Anyone does the credential that start the process and anything? Let me ask. Khushi, did you do anything? Anyone start it? Smith,
Yes, ma'am.
you started. You know what is the procedure? Credential, let me explain. Credential is a 5-step process. So credential, again, I told you, right, that it is an evaluation portion, students' evaluation about their process. So credential contains the 5-step process where verification of identity through the authentic valid documentation, completion of university level, that is your bachelor level. It's even though you are master or PhD degree holder, entry level practice is bachelor. So completion of university level, entry to practice degree in physiotherapy, that is the bachelor level. So for the credential point of view, you just put your bachelor degrees, more than enough. Even though you are masters and all, once you are a physiotherapist, you have access with the college portal. You can upload your documents as a master degree and PhD holder. But for the exam point of view, we are going with the bachelor degree. Third criteria, which is a successful completion of minimum 1025 hours of supervised clinical practice. Now here, students, like I got a number of the questions here. The questions are, these hours are our internship hours. So answer is no. This is your bachelor hours. Bachelor hours means starting from your first year to the final year, whatever clinical practice that is written in your transcript, that successful completion of 1025 hours of supervised clinical practice, that is mandatory for your process of credential. Okay. Now another one thing, verification of identity through the authentic valid documentation. Here, those students who are first time appear, so you have to approach to CAPR, Canadian Alliance Physiotherapy Regulator. So whenever you are approaching CAPR, and if you are first student from your college, then it is little bit lengthy procedure versus those students who already appeared for the credential and followed by the other students from the same college. They have a little less lengthy procedure. I can say student A and student B. So there are two students, okay? Student A is the first student from the college and university. And student B from his college, the seniors already, senior already does their credential. So in both the scenario, CAPR only evaluating first time. Those who are the new thing, they take time to evaluation, but already your seniors or your follow, or like the elder ones, already procedure the credential process. So same college, same universities, your process is fast. So if you are a first student, be patient. Don't be like tense that, okay, I'm the first one, I don't know what to do. They are asking a lot of to and fro documentation. So it is a mandatory because they are aware about the new concept, new college, new universities. So it takes time, but hardly it takes 2 to 3 weeks more, not that more than that. But be patient with that scenario. I am getting few questions regarding this scenario. That's why I'm explaining this thing. Otherwise, it's okay. Fourth criteria, your communication skill, either English or French. Both is not mandatory, but anyone compulsory mandatory. And the fifth criteria is knowledge of practice of the physiotherapy within a Canadian healthcare system. So we all are international physiotherapists. So when as an international physiotherapist, you are planning to work in Canada, you have to understand Canadian healthcare system and its ethics. So it is an ethical practice. Okay, so few concepts always mandatory about your knowledge working with the healthcare system, and that is must. It is not any portion of the written exam. No, this is a portion of your credential. You must finish this course. It is an online course you can do from your home country, 3-month duration, and once this course is done, result directly go to the CAPR. You are not supposed to provide the result from your end. Result directly go from your academy to the CAPR. So these are the overall 5 criteria. Any question we will discuss in detail, but any question that you are not getting idea, it is a credential process. It is your first step and mandatory. Without that, you are not going ahead. So if you want to become a physiotherapist, you have to do this thing. No option. Any question to anyone? Yachna, Dhruti, Rashid, Yuvraj, any question?
No, ma'am.
Good? Okay. Should we proceed? Now, few of the students already go my old videos where I already explained about the credential process, but now there is a new changes happen, and this new changes is very easy, very simple, and it is easily fast process, time consuming, time preventing, and the faster process, and that is the online. So now they make the online client portal. It is same like you are working for Amazon. Okay. So in the Amazon, if you are going with the shopping, so you make your portal, and in that account, so portal means account. So in that account, you gonna purchase your product. Same thing here. You have to go with the CAPR website, Canadian Alliance Physiotherapy Regulator. In that website, you have to approach the client portal. You are a new client, you have to create account button. So in that create account button, they are asking questions about your name, about your college, about your degree and all these things. Once you are fulfill your required field, click the submit. They start your creation of the account, the password and all these things, right? You have to password and ID. So you have to generate the ID, password is yours. So it is all protected. Once you submitted, that client portal is initiated. In that client portal, now your profile is generated, and now you have to click on apply button. So apply tab, you are gonna purchase create credential application. That is your purchasing thing. So the create credential application button will only show for the applicants who are eligible to apply for the credential. So these are, they are asking questions, your credential hours, your college, your degree level. So these are the simple questions you have to put on the question answers portion. When you are going to click, you get this create credential application. When you are selecting the create credential application, if it is appear on your profile, that means they consider you as the eligible student. First thing is payment. So you have to go with the payment. Payment must be done by the credit card. That is the most preferable, safest method. So after you have selected payment by credit card, you will be directed to the shopping cart to complete your payment. In that one, you have to put your number, your expiry date and all this thing, which billing address and all, and submit the order. Once payment has been successfully proceed, you get the order confirmation, and then you are directed with the upload the documents. Okay, so once you are paying the fee, upload the documents. Within application list, apply the clicks on the detail buttons. So on your credential application, you click that, upload the document. Here they are asking about your documents. So now, here I want to show few things. So in the Canadian credential, students, college, university. Okay. Particularly for those who are from the India, Sri Lanka, Bangladesh, Pakistan, they are following the same criteria. Students. So student must submit their identity documents, that is the passport. If they are married and they want their name is changed in your credential process, marriage certificate. Now here you have to submit the marriage certificate directly, and degree certificate. Here there is also the internship certificate. I can say upload the documents because it is online. So just scan your documents in your mobile and then upload it with the uploading documents. So that is your uploaded documents. You have to upload all these documents. Maximum is this much things. Already they are asking your name and all these things. In the older version, there is a form A is supposed to fill. Here, this form is null. There is no this type of the form. Yes, name changing form is available. Those who are transfer from before marriage, so like before marriage to the after marriage name, there is a name changing form is there. It's up to you, but this is the requirement. Form A, form B, form C is this type of the forms are now not available. It's directly online. Clear? And payment also, there is no specific form that you have to fill. You have to directly fulfill your identity documents and the credit card details, everything online. Payment is proceed as per the their online payment system. Any question here?
Yeah, ma'am, I have a question.
Go ahead, Smith.
Yeah, so you tell if the person has to change the name after marriage, he or she has to do the name change form, right? Yeah, so the name, the in the passport, my wife's already name has been changed, but in the degree it's different, like because after a marriage. So if she does not want to change the name because in all the medical documents is the same name, and she wants to go with that, but the passport name is different. So what should we do? We just apply for the name change form, or what should be the process?
So you are saying that your identity document already name is changed. She does not
Yeah,
have any identity document with the before name.
like she has old passport, but I don't think so it will
It's
be
not
considered
valid.
because
It's not valid.
yeah,
It's
and
not
Aadhaar
valid.
card is also has been changed with the new with
New
like
one.
yeah,
Then
because
here
for the
you
passport application we have to change everything.
no, the thing is here what you're gonna do it. Name changing form is those who want to change the name from degree certificate to the Canadian license. But
Okay.
your question is different. Your question is you don't want to change your name from your degree to license. You
Yeah.
only
Yes.
change your identity documentation, right?
Yes. Yes.
Yeah, so
Yes.
in that scenario, you are not gonna fill this name changing form because your name is not changed from your degree certificate to the license. So whenever you
Okay.
fill your form, online form with your identity, like for example, your I'm like my Mamta Kansara. So my before name is different, right? Sony, for example.
Yeah.
So in that one, I'm just putting Mamta Sony and all these things. Upload the documents and everything. But whenever you are submit your official that passport and all, so I prefer you just gonna mail by yourself. Mail means post, okay, not email. Do
Okay.
the email as well as the post by showing the passport and the marriage certificate, which is notarized. So this is the most safest way. You're gonna mention
Okay.
that I don't want to change my name from my degree to license. I want the same name. Only my identity documentation changed due to the marriage, and this is a marriage certificate with the notarized copy. So
Okay. Okay.
that they can consider, because online this is not a system.
Okay.
Clear?
Okay.
Yeah.
Yeah.
And if you have
Thank
any
you.
other doubt, you can email. I will post the email as well, info@credential gmail, something like that. You will get that email. If you ask that your concern, they will answer you within a 3 to 5 business day.
Okay. Okay, ma'am.
Okay, perfect. Name changing form, good to ask. Name changing form is those who want to change their name from degree to this. For example, Mamta Soni to Mamta Kansara. So my back surname is different, and now the new surname is different. And I want my license with the Mamta Kansara. That one I have to fill the name changing form. Okay. Okay. So this is thing that student has to submit, and if it is not online available and you have a requirement, you get the email in form of that required document is missing. You can fulfill that document by post, and by post is known as by mail. So they mention by mail equal to post. We have to do the post, okay, not email. Perfect. Any question? College. So through the college, document request form must, your transcript, your successfully completion of internship certificate. That is must from your college. And college one is not online. You have to go with the, again I am saying mail means post, but here keep in your mind, students are not doing anything. Again I repeat, students are not doing anything. Student requested to the college, and college submit their document in the envelope, sealed envelope to the CAPR. If CAPR always getting the idea who is the sender. If the sender is any relative, any friends, or by yourself, it's null. You are not gonna, they are not accepted this document as a authentic document. So college must submit the documentation. Okay, so this is a must field. And now the another thing is university. University only and only mark sheets. So mark sheets, again, it is a sealed envelope, and you have to, like, mark sheet, not you, your university. The university must mail to the CAPR. Students are not involved as a sender name. Keep in your mind. And now the good news, for few universities, they consider online. So here for the university, they consider online. Particularly for the India, it is the, I put it, no, I didn't put it here. Sorry. So particularly for the CAPR, you can search on that one. University of Bombay and Gujarat University. These two universities, they accept the document online. And the other universities are from the Australian University, Columbia University is not there. So there are few universities that you have to put it as a, you can go with the online submission, otherwise you have to do the mail. So this is your basic credential. Clear? Once you upload the document has been uploaded, notification, click submit. You will be returned to the required documentation table. Documentation name, received date is now listed. And if it is accepted, you are getting online access, accepted, pending, not accepted, it is there. So now you can see your progress through online. Initial early days, you get the back mail in your required address that, okay, your document is accepted, not accepted, what is the rationale, why they are not accepting the document. Everything is in the paper form. Now everything is online. So you can check your progress, that where your progress is. They also mention that, okay, right now we are on the November applications, and if your application is in December, you are already prepared that, okay, now my application will be proceed soon. So time limit, time frame, upload documentation, accepted, not accepted, everything is easily accessed through your client portal. Okay. Forms, only few: name changing form, documentation request form, and graduation verification form. This form, okay, so this I told you that if you want to change the name changing form, document request form, it's for college. Now those students, for example, they are in their internship. So they are not getting their degree certificate yet, okay? But they want to start the process, so they can go with graduation verification form. So in that graduation verification form, they submit the documentation and like there is a form you can submit. Your credential is not done until your degree certificate is achieved. But you can start. That's why graduation verification form, it is not valid instead of your degree certificate. You must provide your degree certificate to the CAPR, then and then your credential is done. Clear? So if we are going with the few things, so student, online portal, you have to submit your identity documents, your valid documents easily online. Before there is a requirement of the notarized thing and all these things. Now it is everything is excluded. Just submit and upload. College and university both are different with particular countries, but particularly for those countries, India, Bangladesh, Pakistan, these countries are going with the same flow. College document request form, official transcript, and supporting like the clinical practice hours. And if graduation verification form, it is also everything through the college. Here I want to add one more thing, that if you are putting internship certificate, put it with the college as well. It's only additional document, but it is the safer side. It is not mandatory. Again, I'm repeating, it is not mandatory, but I believe that it's easy for us to go in the smooth way. Yes, Yuvraj, any question?
Yeah, I already have my internship certificate.
Hmm.
So is it like optional whether I upload also or only the college have to do it?
No, you upload is okay. Before what happened, Yuvraj, if the student is uploaded, they have to go with the notarized.
Okay.
And if the college is college is sending, it's just college seal in the college envelope, they can put it.
Okay, right.
That's
Thank you.
right. But I prefer like if the college already provide the mail in the one envelope, one document is there. It's for us, it's a mental piece that it is appropriate. But in the online portal, they are asking about the internship certificate. So you can upload now. It's easy.
Okay, thank you.
Yeah, you're welcome. Any question? So these are the overall thing that you have to consider. And university, again, I repeat, few universities, they are accepted online. So college must be offline. It is mail. And universities online. Few universities, there are 7 or 8 university only. But Gujarat University is one of them. And I think Bombay University is also the thing for the India. I am sorry about the other universities. Right now, I have no idea. Actually, I have idea. There is an Australian university, one American university. But regarding the Sri Lankan university, I have no idea. So go with your side as well for the double confirmation. Only university provide the sealed mark sheet. Now here I got a lot of questions from the student side. And what are the questions? The questions is name difference. So the name difference is first year mark sheet, second year mark sheet, third year mark sheet, and the fourth year mark sheet. First year, for example, my name, Mamta. My one name is Mamta. I can say. Second name, there is a Mamta Ben. Third name, Mamta Ma'am. Fourth name, Mamta is okay, but my husband side, not my husband, my father side, obviously my certificate is from my father side. So the father name, for example, Vijay Kumar. In that one, Mamta Ma'am, Vijay Bhai. So this is the variation of the name, even the student is same. Now what to do? So this is not acceptable actually. So try not to put this type of the variable names in your every year's mark sheet and all this thing. It is very, very important thing for the student life. So when you are a student, you are aware about this thing. And now if the mistake is happen. You cannot do anything. So university is not changing the name. University is providing the mark sheet as per your all the altered name, but then you have to submit notarized copy. That is a legal copy from your side mail stating that this is a same student with name. But again, it's all depend on your officer, what they are asking the required document. So for example, Yuvraj versus Bansri, both has the same problem. But the Bansri's official, those who are the taking care of that Bansri's documentation, he is okay with the notarized copy. But Yuvraj documentation, they are asking that, okay, give me any official ID you have to provide. So it is a vary from student to student, but whatever they are asking, you have to provide. One thing is notarized copy, legal copy, and if you have any supporting document with a different name, you can provide it. Clear? So these questions I come across. That's why I just put it here. So try to avoid the mistake, first of all. And if you mistake is happen, mention it. So rather than they put query, you already mentioned that, okay, this is happened and this is the solution. Clear? But still, it depends on them. Whatever they are required, you have to provide. Now the third thing, other institute. So other institute, language test score and health course. So these two things, student never provide their result to CAPR. It must be through their appropriate institute. So generally IDP. It is appropriate institute. They are going with the language test score and the health course. It is depending on your university. So now let's go with the language score. Language testing score is agency. So here now they are accepting this all, any of one. Okay, Canadian English Language Proficiency Index Program, International English Language Testing System, General and Academic, that is IELTS, TOEFL, French, and the French. So two French tests, TOEFL, IELTS Academic, IELTS General, and the scoring, minimum criteria for every system. If you are going with the general, reading 7 band, listening 7 band, writing and speaking 6.5, applicable to the academic as well. TOEFL 21 in each. French, actually, I'm not having a lot of knowledge about the French test, but yes, the French test, that is the minimum scoring they identify. TOEFL, overall, they put 92 and minimum scoring. Both the criteria is present. IELTS, there is no overall criteria. Okay. Now here another, I'm putting one more light that if you are applying as a student visa, so for the student visa, you must prepare for the IELTS academic, right? And if you are applying for the permanent residency, PR, so for that you are appear as the IELTS general. So prepare yourself in such a way that minimum you get this much. So by this way, you can put your student visa, You can put your PR application and you can also start your credential process. So one test, one result, and you get 2 tasks. Okay, so this is few things that I'm gonna enlighten here, that if you are planning this way, focus with the score. So that score you can use for your credential, and don't wait, please don't wait. If you achieve the score, that score is valid only for 2 years. So within a 2 years, you must submit, and this score is also required for your bridging program. So when you are trying to enroll yourself for the bridging program, they also require IELTS with minimum band. There is not particular requirement, but I want, if you give the IELTS within a 2 year, you must successfully do your credential process start and your bridging program. So there is no need to give further IELTS. Clear? And don't worry about IELTS. All the students are too much in tension with the IELTS. That, oh, I have to give the IELTS. It's nothing. It's your profession, like communication skill. So how to communicate? What are the techniques to crack with the listening, writing, speaking, reading? And it is must. If you are already going with the Canada, English-speaking countries, Western countries, your communication skill must be valid. Then and then you are able to treat the patient. So don't be afraid about that communication skill. Focus with your improving portion and you will achieve the score. It's not the big task. Clear? Any question? Otherwise, I have a question. Any question so far?
I have a question.
Go ahead. Good.
Yeah. This IELTS. So can I start the credential process first and then go for the IELTS later?
Yes.
Because I'm like Malaysian team physiotherapist. I'll be traveling a lot. Next 2 months I'll be busy. So is it okay if I start the credentials first and then after I finish my tournaments and all, I can come and do my IELTS and upload the score?
100%. 100%. So the credential, it started it within a 2 year. That is the time limit. Okay, so you have to upload your all documents and everything. But once it is started, they open their file. And it is valid for the 2 years, you have to submit everything. Okay, so within a 2 years, anytime, middle of the credential, you can, even my case, if I'm personally, I'm sharing my experience, I started my credential, but I didn't even didn't book the IELTS. I booked the IELTS in the middle of the process, and then I clear the exam, and result directly go to the CAPR. So it is not an issue. Any question?
Thank you. Thank you.
Yeah, ma'am. I wanted to ask, after like we enroll in the credential, you said that we have to do Canadian healthcare system 3 month basic course, which is compulsory. So like I think so it's an online course, like it's just a course. So like we can start with that and later on we'd give IELTS, or it's necessary to first give IELTS and then do that course.
No, yeah, I got your point. Bridging program enrollment require IELTS criteria. Few course. Now again, Smith, it is depend on your university. Like one of my student, they didn't ask about the IELTS score, and most of the student they ask the IELTS score. So now depend which university you are enrolled and what is their requirement.
Okay. Thank you.
Okay. Any question? I got one question in the chat box. What is the duration of handover the IELTS result? Yeah, within a 2 year anytime. And it is not you are hand over the IELTS result, academy that you are enrolled with that. Now, for example, you gave the IELTS and you didn't score. Your score is 6.5. So you have to give again. There is no other options. Okay. A minimum requirement in each criteria is must. So you have to give the another time IELTS, and that is valid. So until you are not achieving the required score, you have to give the IELTS. Any question?
Yeah, ma'am. I have one more question. You said that institute have to submit. Like how IDP will be submit, because we give the test and they just send us the mail with the result. How they are gonna submit it?
No,
Like
there is a procedure. They know.
okay.
IDP, you just email, or otherwise, whenever you are, have you given the IELTS or have you start the process? to register your?
I've already have IELTS like academic,
Okay.
but
So
my
did you fill the form in the IDP?
yeah, I already got the result.
In that one, there is a question. Do you send your result to any institute?
I have no idea if I have
Okay,
seen
you
that.
may miss the question. Okay, it's okay. If you miss the question, it's okay. Once your result is arrived, you just mail the email the IDP center that I want my result must be sent to the CAPR. There is, I think there is no charge. They can send it. IDP does this.
Oh,
So many.
okay.
Hello, ma'am. I have a
Yeah.
question.
Go ahead.
Actually, I'm a physiotherapist in Sri Lanka. I have basically a higher diploma in as my qualification in physiotherapy. So I'm hoping to apply for this this process. And my question is, I have come to know that I have to follow some bridging courses in the credentialing process, as I have already a higher diploma. I don't have a degree. So for the in case of that following that bridging courses, what type of IELTS I have to follow? General or academic?
Again, so see, your case is different because your one is entry level practice is a bachelor degree, right? You did
Yes.
higher diploma.
Yes.
Right? So your scenario is different. Now in that
Yes.
scenario, they provided that, okay, go with the bridging program. So
Yes.
whatever bridging program, now let's go with the, just a minute. So they provide you the any documentation that you can go with the bridging program, because generally for the CAPR credential process, bridging program, you can go with the university, any one of them. University of Alberta, University of Toronto, University of Montreal, or McGill University.
Okay.
So this is the bridging program thing, that you get this certificate for the entry to practice. These are also internationally educated breathing program. So depending on your chosen course, so if you are going with this university, they have a requirement, because one university has minimum 5 band or one has a minimum 6 band overall, and they are good to go like that way. Now I am not right away like clearly say that, okay, particular this university, this is the criteria that you have to go with the university.
Okay.
Do you get any email from the CAPR showing that, okay, you have to do the bridging program? Because they always provide the options.
No, I haven't started it. The process I haven't started it, but I'm looking for that.
So you start your credential process, right? Or not yet?
No, going to start.
Going to start, yes. So then once you start it, then you will get the email from the CAPR, okay, go with this bridging program. They will provide the information, and it is available online.
Yeah. Unless I get that email, it's better to choose the IELTS after that, no?
Okay, so you are saying that IELTS minimum band. See, this 7 band, this is the requirement of the CAPR. Bridging program is always less requirement than this.
Okay.
Okay, so if you are giving any of the IELTS, general or academic, they are not particularly that you have to go with the general, you have to go with the academic. No, they are not asking this thing. They are asking IELTS band.
Okay.
Okay, if I'm personally, I'm sharing my experience. I start my credential process at that time. Only academic is the option. We don't have the option about the general in my time, 2014. So I went to the Canada in 2014. Within a 1 year, I clear my license for the Canada as well as the US. I am both the country license holder. So at that time, only academic is the valid. But I went through the PR basis, permanent residency, right? So in that purpose, I gave IELTS general, I gave IELTS academic. IELTS academic I'm using for my credential process. IELTS general I'm using for my PR process. Meanwhile, for the bridging program, I use my IELTS general and they accept it. So there is no particular thing that, okay, academic and general. Nowadays, if the system change, but if system change, they mention in that university level. Like if you are going with this bridging program, requirement is there.
Okay.
Clear? Any question, anyone?
Thank you.
So for band wise, general academic, now there is no like particular change. It's up to your requirement. If you want to go with the academic, good. If you want to go with the general, for the permanent residency, it is easy for you guys. Okay, so that way it's different. But this is a maximum score. Bridging program always required less than this. That I'm sure. So this is the one thing. And bridging program, any of that, University of Alberta, University of Toronto, Montreal, and the McGill University, you can enroll yourself and finish the course online. Result directly delivered to the CAPR. You will also get the result online and result also delivered to the CAPR. So where we are discussing IELTS credential. Now I have a one question because I got the few questions from the student. WES. Anyone heard about WES?
Yes, it's
WES.
international credential verification.
So WES verification is not valid for your Canadian physio license, please. So WES credential, you are doing it for your PR application. That is your status in Canada. And Canadian physiotherapy license, it's your professional license. It is must be done by via CAPR. Okay, so keep in your mind, both are different. Students are always saying that, oh, I did the WES, why I need to go with the CAPR? It's not my rule. It's a professional license. This one is a resident, your status in Canada. Okay. So this thing is must be, you are aware. So overall is this: credential, student, online portal, college, university, language, and your health course. Any question?
No.
Good. So this thing is why it is important. And the important thing is time. You know what? You have costly thing in your life is your time. What is the best time is the present time. I am not aware about the things. I am wasting my time. Already wasted. You are not wasting your another time, please. So right time, present time is your best time to start your preparation. And if you want to become a physiotherapist, you must go through this thing, this procedure. There is no like loophole or there is no like shortcut. You have to go through the procedure. So that is must take. It is just 15 days. Within a 15 days, you will do everything. You are not doing the credential thing. You are not evaluating your document. You just upload, college, submit the document, university, submit the document. IELTS is the one that you have to go through it. Online bridging program, I am saying it's very easy. They are showing the videos and then they are asking the questions. What you learn from this? It's just ethical knowledge because the Canadian system is a multicultural system and where we are belonging from. So our ethics are different, cultural values, every culture is different. So when you are working in a multicultural society, your broad-minded ideas, ethics, safety is must in Canadian healthcare system. Consent, disclosure of the privacy thing, it is must. You cannot disclose to anyone. So this thing is the basic and that must be learned through your bridging program. Okay, so this is the primary requirement. And again, you are not doing everything like, okay, I submit the credential, now I'm going to wait when I'm getting the result, I start my PCE written preparation. You are wasting the time. Okay, so now what the thing? Let me give you this idea also. So credential, approximately it's a 2-year duration, approximately. Credential, if you upload everything properly, your documentation is properly, it is the minimum time is 6 weeks, 4 to 6 weeks. This is mentioned in the website. But once your procedure start, then 6 weeks. But right now, if you submit your document and they are with the November team, so you are already 2 months behind. And then once they start, then 6 weeks. Okay, consider that way. But you have enough duration to submit your document and all these things. But once your credential is done, you have a 2 years maximum time. During that, you must give your first PC written exam. So my request and my obviously Global Physio is helping the student with the PC written exam preparation. But my advice to you guys, don't wait for your credential result. You already applied the credential, means you have to go with the written exam. So start your preparation. It's not easy and it's not tough. Nothing is impossible. Everything is possible if you are committed, if you are dedicated, and if you are concentrated on your work. That's it. That is the main thing in your requirement. And now if somebody say, or if you are thinking that I am smart enough, I can do this PC written, I can crack the exam within a 2 month, impossible. For me, I always believe minimum 6 to 8 months. There is no shortcut. Because you are giving your first exam as a trial, no, to clear the exam. So first is your direct hit. You have to achieve your target. And for that, you must go through all the things. Small things also matters. And what is the costliest thing is time. Why? Time is the costliest thing, because the thing is, you are obviously financial is the one, also the burden for everyone, including me, including students, or any of the things. 10% they don't have the financial burden, most of them going with the financial adjustment, right? Credentials, fees, and all these things. 1014, 1435 something or 85 something is the fee for the credential. So credential fees, your IELTS, your bridging program. This is your mandatory fees. If you are coming with the written classes, your fees, and the written classes as well as the written exam fee. Credential fee is different, written exam fee is different. Now, if you total overall this thing, if you clear your exam within a 1 month, 1 or 2 months, you can get your money back. That is only and only if you clear the exam. So if you are decided, you have to clear the exam. You are not leaving your preparation in middle of the something. If you are thinking, let me start my credential, I will see afterwards. Then why you start the credential? There is no need. You start your credential to achieve something. You take something back step to jump higher. So this is the main important thing to clear the exam. Okay. So keep in your mind. This is important. And obviously, PC written preparation classes, Global Physio Academy, myself, Mamta KANSARA, always provide you the 100% guidance. So what is the written preparation class? So before that, why the PC written exam? This regulator, it is written on the website, the regulator ensure that physiotherapist entering practice in Canada have the minimum competence level required for safe and effective practice. Reason is every physiotherapist is competent and ethical physiotherapist. Ethics is must. Physiotherapy exam, ethical scenarios and ethics is very, very important. And this physiotherapy Canadian ethics is different than the US ethics, because I'm taking 2 classes, so I know you, and I already cleared the exams. I know that what is the Canadian ethical classes and what is the Canadian ethics versus US ethics. Mission to support the physiotherapy community in the protecting the public, because you are a public servant, so you are working for the public, safety of the public, and in the ethical manner. What is a PC written exam? So written exam is a 4 hours computer based multiple choice exam, 200 questions, and in the PC you are encounter with the Vignette based. Anyone has idea about Vignette style exam? What is the Vignette? Nirali. Actually, I am the always outspoken person, so always I like if somebody asks me the questions and I can give the clarity of that question. Nirali.
Yes, ma'am.
Vignette style questions.
It's MCQ type question.
MCQ is there, but still Vignette means what?
It's scenario based, right?
Exactly, scenario based. Scenario based means 37-year-old lady coming for headache and neck pain complaint after working 8 hours on computer. Upon examination, she revealed as she is 4 months pregnant and having a 2-year-old child. So that is her second pregnancy. She has a 2-year-old child and she is a computer programmer. Okay. So this is the one scenario they are already given. Now in that scenario, they may ask questions about the forwarded posture. They may ask questions about the intervention, that which muscles you are giving stretching exercise, which muscles you are giving strengthening exercise. They may ask question about the assessment. So they may ask about the plumb line. They may ask the question about the ergonomic. That what is the computer level, what is the wrist level. So they may ask these questions. They may ask questions about the physiological changes associated with the pregnancy, ligament laxity and all. They may ask ethical questions. Lady has any abuse, or lady is in the stress, lady is in the depression, whom you gonna refer. So this one scenario and you get 6 to 7 questions related to one topic. That is called Vignette based. Clear? So for that Vignette based, scenario based, first of all, you have a thorough idea about the topics. So topics are 3 topics here. One topic is the posture, another topic is pregnancy, and the third topic is ethics. Okay, so first of all, your theoretical concept is clear, and then you have to involve all theoretical concept in one scenario. That is your Vignette style question. And 10% standalone. That is your PCE written exam. PCE written exam is PCE written exam is the conceptualized and designed content development and review exam, administrator, statistic analysis, standard stating, whatever student score, reporting, and then ethical exam maintenance. So this is the overall framework of your exam and the score, written exam score. Now written exam score, just a minute. We will come back with this question back. Written exam score, yes, written exam score, 200 question, each question is equally weighted, 1 mark for the correct answer, 0 mark for incorrect answer. So I must say go for every question. There is no negative marking. Okay, so total score, that is your row score. And now for the exam point of view, so you give 200 questions. So definitely your score is out of 200, whatever you are achieving. So that is the 200. But every exam, they put the cut score, passing score. Okay, passing score. So for example, they ask 200 question and passing score is 140. So minimum 140 you must achieve. That is a passing score, cutoff score of every exam. So January has a different cutoff score, February has a different cutoff score. And they are using this method, but we are not digging this thing. It's just for your knowledge. We have to dig our correct answer. That's it. Okay, and then this setting is designed by the panel, registered physiotherapist panel, and that score, your raw score, is converted into the scale score. So scale score is 800, and out of 800, passing is 600. So every time 200 passing score is different, row score. Row passing score is different. Sometimes 140, sometimes 150, sometimes 135, depending on the passing score and what is your score. Okay, so this is the passing score and your score is, for example, 150. And now this 150 is converted into the scaled score. Okay, and this scaled minimum is 600. Now again, PC passing score is always 600 in the scaled scoring. So doesn't matter what is your cutoff score, in every exam, your scaled score must be 600 and above. Clear? And for that, I want every question must be answered correctly because it is our bread and butter. So this is your overall PC. I can just frame the idea. And now what is my class provide? Global Physio. So I believe for students to clear the exam, they must pass through different theoretical classes and mentoring classes. So in the one class, if you are registered in one class, I am providing two things. One thing is the theoretical classes, another is a mentoring, and both is required to clear the exam. You are not coming with me to gain the knowledge. You are knowledgeable physiotherapist. You are coming with me to get the passing score. Okay, and for that, your concept and your mentoring both are important. So the first component is the theoretical classes. It consists of more than 60. I can say 65. My classes is always like more than that. As per the blueprint, all the classes. So right now I'm taking the classes. This classes is converted into the recording, and that recording you have access until your first exam. Ethical classes is different. PCE ethics is different, which contain 10. This time I'm giving 12 classes. So 10 is a minimum requirement, 10 classes with ethical based scenario questions. I'm going to provide it. Okay. And once you are done, so my theoretical classes is minimum 3 months, 3 to 4 months. I'm not like fast forward person that, okay, within the 2 months, my classes are done. Because see, I'm done with my topic. I'm shoulder shot, I'm done with the three maximum 3 classes. Are you able to done your point through the Maggie, through the Kishner, through the referred books, Dutton and all? So it is your task. So I always believe student must be parallel with me. So my classes are always 3 to 4 months. It's not 2 month classes. All the classes I'm taking because I personally believe in every student's need is different. Limited batch. And second component. So once your theoretical class is done, for example, you start your credential process and you are planning to give exam in 2025. You enroll with me on the theoretical classes, which is done by June. Okay, for example. Okay, now June 24 and 25. So mentoring class is also 3 to 4 months. Minimum I need this time to give you the enough time frame to prepare everything. So in the mentoring classes, it's not a passive learning. Theoretical classes, I am providing the teaching, I am providing the idea, what is this, how to prepare everything. Mentoring classes, I am bombarding with my students actually. Why? Because active participation is must. Exam is your name, result is your name. I'm the guiding person. So mentoring class is your active participation is must. If you are not prepared, I'm saying you are not eligible for the exam. Even though you get the certificate. So having a certificate is not eligibility. Eligibility means you are confident enough to get the exam and to clear the exam with your attempt. So mentoring classes, I am throwing the question and answers with the correlation. Same like I told you, right? Pregnancy lady, I may ask the question about the posture. I may ask the question about the ergonomics. I may ask the question about the ethics. So correlation is mingled with the mentoring classes and plus mock exam. So when you are giving Vignette style mock exam, you are thinking, okay, I am ready. And I also aware about the students' capability. That what are the students' capability? So this is the written preparation. So what is covered in theoretical classes? So theoretical classes, I'm gonna cover everything what you require, and that is the MSK, neuro, cardio, pulmonary, other system that include the integumentary, vascular, that is the blood and all the disorders. I can say modalities. Other topic like the scleroderma, polymyositis, psoriasis, that are the other topics, cancers, that all covered into the other systems. Pediatric, geriatric, psychological disorders, and main ethics. So these all the theoretical classes with according to the blueprint. I believe in book. I'm providing the PPTs and all this thing. I'm providing the lectures. I'm giving the idea, but I prefer my students go with the book. If you are good with the book, it's easy. Now somebody is asking me what are the books. Our physiotherapy books, Kishner, Credential, Sullivan. Books list is given on the website, but these are the most important books that you go through this. Therapy Aid, that is also the important book. Maggie, most important. Hillgrass for the cardiac pulmonary stuff. So it is very important books that is covered in the theoretical class. And what is mentoring and why it is important? Because mentoring evaluation of your students' knowledge. So mentoring means you know that I done with the topic, but then why I'm asking the question, I know that you are lacking here. Correlation is this. So this is important to crack the exam and to evaluate yourself with the third party. Okay, and there is no extra charge. I believe if you want to clear the exam, you need everything. So theoretical classes followed by the mentoring classes in the one batch. Now physiotherapy blueprint. So for the physiotherapy blueprint, there are two things, domain and area of practice. Area of practice is this musculoskeletal, neuro, cardiopulmonary and others. Every is divided in your score as a scale. So you have to gain this thing. Overall, you get the 600, okay? Overall area of the practice, you get 600 out of 800. That is the scale. Domain. Domain is physiotherapy expertise, communication, collaboration, management, leadership, scholarship, and professionalism. So this domain, 50 to 60% expertise questions. So approximately 120 items out of 200. Communication, collaboration, management, 5 to 7%, 3% like that way. Leadership, scholarship, and professionalism. Now, what are the, how they are incorporated? So you get this area of the practice with this domain. Means, again, I ask the pregnancy, same scenario, pregnancy topic. Okay. And I am evaluating the forwarded posture. So that is my expertise. I am believing patient needs ergonomic advice. So I am referred to the occupational therapist. So here I am using a collaboration. Now patient has a severe headache, feeling the fetal movement is decreased. So I'm referring to the physician. So here my collaboration, my management and expertise, all the domains are counted. Patient has a question that, okay, why Mamta you are giving me the ergonomic advice, or why I should wear the splint if she has a carpal tunnel syndrome. So I am explaining, I am educating her. That is the come under the domain of communication. So that way domain works. According to your question, your domain is count. Leadership. Leadership means in the Canada, physio are working with the PTA. So what is the PTA role? So you are on the leadership and you are working with the PTA. So you are eligible or responsible if the PTA does some mistake. That is ethics. So that comes under leadership. Scholarship, you are using the ethical practice, evidence-based practice. That is your scholarship. And professionalism, boundaries, your patient and therapist relationship, that is your boundary, professionalism. With the doctor, if the doctor is referring you anything and you are getting the commission, it's not your boundary, it's not your professionalism. So professionalism is also the one of the domain, and it all comes with the ethics. So that way your exam is running. And I'm providing every concept in my Global Physio Academy in terms of written exam preparation. Any question? So this is a passing scale, minimum 600 out of 800. That is your scaled score. So that's your goal, written exam. Once you clear the written exam, you are eligible to become the resident PT if you have a mentor. Now, mentor means what? Those who are registered PT, like me, having a more than 3 years experience, it is easily available. It not easily, like you get it, mentors, and you can work as a registered PT. And now clinical exam, every province wise different. Ontario clinical exam is different. I think Ontario clinical exam is conducted online. So if you can clear the clinical exam online, you become a registered PT. And one more thing, it is not mandatory to work as a resident PT, then and then you give the clinical exam in some province. So you can give directly clinical exam before working as a resident PT, okay? And you achieve your registered PT license. But some province like Saskatchewan, Winnipeg, where Manitoba, where 1200 hours are mandatory. So you have to follow the province-wise rules and regulations. So return, approach with the resident PTs. And then clinical, you are approaching with the registered PT. And congratulations, you are a physiotherapist, achieve your goal and the dream. So if you are planning to start the credential, go with the full thing. So don't wait about your result and then start the preparation. Preparation also takes 8 months. Credential also takes the 8 months. So be parallel. That saves your time, that saves your all the efforts, and you can achieve your goals in an appropriate timely manner. Time is important. For any preparation, you can contact me. You have my website, email ID, Instagram, Facebook, as well as the contact. You can contact me in any way. I'm always happy to help the students because I believe that students does not get any obstacles to achieve their goal. Okay, for that I'm always happy to help them in any up to the written exam in any scenario within my scope of practice. Okay. Thank you. Any question?
Yes, ma'am. I have one
Go ahead.
question. So you said that every province have a different criteria for the clinical exam and for the registered PT. So
Yes.
if I became in Ontario registered PT, am I not allowed to work in Quebec or Saskatchewan
Very
or?
good question. I'm happy you asked this question. Thank you, Smith. Okay. So, Ontario, you become the registered PT. Okay. That is the law. Once you are a registered PT in any province, you are entitled. You cannot work other province because your license is with that province. But in any chance, you migrate to other province. So when you are shifting to the another province, you just need to do the paperwork. No need to give the another exam. So now in that scenario, if you are on Manitoba, you work 1200 hours, you got your registered PT license, and then you enter in Ontario. No need for the Ontario clinical exam. You have a registered PT license, just do the paperwork and communicate with the Ontario College of Physiotherapy, Ontario, what are the required documents that you have to submit.
Okay, thank you, ma'am. I just have one last one.
Very good. Go
Uh,
ahead.
like if I start after like from tomorrow, like how long it will take, like to be the registered PT? Like 1 hour, 1 year, one. Like I just curious because just wanted to know that.
Approximately time I can say, okay? I
Yeah,
can say about
approximately.
your time, approximately. Approximately credential. Again, credential takes, considers, I can say 4 to 5 months minimum. Because already 1, 2 months is behind is right now current situation because my student already apply the credentials and all. So right now is the November is going on. October, November. So still they applied just now, it's January, it's a 2 month delayed, and then so approximately. And it is up to your uploading documents. So if to and fro happen, your IELTS is not clear, or your college document is not valid to submitted, or any name changes documents, any to and fro, adding the time. Okay, that is your one thing. Second thing, written exam. Now they increase the frequency by 10 times in a year. Now here I want one more entitled things or lightening the things. They increase the frequency. They don't increase the attempt. Don't be hurry to go and clear the exam. I know some are like the fast person, I can do it. It's the time. If you are prepared, good to go. If you are not prepared, it's not like some luck work on behind or on you. Hard work is must. So frequency is increased in a year, not the attempt. So be focused that word, not attempt. You have only 3 attempts. So don't run to give the exam. Run for preparation. Okay. So that preparation again, I say minimum for me. Actually, minimum 8 months. Minimum. So this is your required time duration. Once you become a registered PT, you can work or you can apply for the registered clinical exam. Whenever you get the day, approximately within the 6 to 8 months, you will get the date. Like what my students are passing. So that whole process takes 1.5 years. If you are approximately, depend on your preparation, depend on your documentation, depend on your procedure.
Okay, thank you, ma'am.
Any question?
Yeah, so if our clinical has been passed, sorry, not clinical, sorry, credential has been passed, can we like work in any other like assistant to the physiotherapy or any such kind of job, or you cannot work in Canada?
Oh, for PTA, you don't require credential.
Okay. So
PTA,
at least
you
we
can
can work
directly
and we
work.
can do.
It's Canada, it's not USA. In USA, it requires the license to work as a PTA. Canada, very first day beginning, you can work as a PTA.
Okay, thank you.
Okay. For that, you don't require the credential also. Any question? Either I'm a good educator or you are not getting anything. Two scenarios, right? I hope I fulfill your requirement. Yes, Yuvraj.
Yeah.
Hello, ma'am.
Go ahead with the Yuvraj and then Yashna. Go ahead, Yuvraj.
Yeah. The exams, is it like some people advise me better to come to Canada and do the license exam there?
Please.
I already got a visit visa also. I came to Canada 2 times.
That's
So what's your
okay.
advice? What's your advice on that?
See, your preparation matters. I have a students who clear the exam from the India and then they are entering in Canada. And I come to know about the students who gave 2 times exam in Canada with the center and they didn't clear the exam. And then now they are with me with the mentoring. But that is a different story. What my point is, students' preparation matters. It's not matter with the Canada and any country. It is the evaluation of your knowledge. It's not the evaluation of the location.
Okay, understood. Yeah.
Understood?
Because my one friend told me the reason, because like if anything goes wrong with the internet or like any other environments, then you'll be like you exit the like say example when you're doing the exam and suddenly your internet gets cut off, you already exit the exam portal.
That applicable to the Canada as well. So 10 times they increase the frequency, right? Out of 10, 5 times there is the online exam only.
Understood.
Practically, like I come across with the scenario where students start the exam and the fire alarm goes, and in between exam stop because fire alarm stop the internet and everything, right? So they
Yeah.
didn't count that. They considered that thing. There is a glitch happen, but still online there is always pros and cons versus the offline, but most of the scenario they are very solid and concrete exam is nowadays making, so students are easily going with the online exams. There is no problem, like feedback from the online exams, it's very good.
Understood. Thank you.
Yes, Yachna.
Ma'am, can we start job after written exam and before clinical exam?
Oh yes, you can work as a resident PT. And
Okay, and
salary is quite good.
what?
I don't want to say the salary, but it is quite good. Same like the physiotherapist. Like you are physiotherapist. You already work as a physiotherapist. Only your title is resident PT, but you actually work as a physiotherapist.
Okay, thank you. And I'm sorry, but I didn't get idea about scaled score. What is that?
Scaled score. Scaled score is like what is your row score. So see, you give exam 200 questions. Out of 200 questions, every time, you know when you are applying for the PR, there is a cutoff score.
Yeah.
Every time there is a cutoff score. And that cutoff score is decided by the panel. That okay, this time cutoff score is this. Okay. Now out of 200, you for example achieve 500, pass. Like 150 question is right answers. So your score is 150. That is your row score.
Yeah.
So that row score is converted into the scaled score. There is a one formula actually. If you want to dig this thing, go and website, have a look. There is a formula they are giving that cutoff score like rows cutoff score minus row score divided by scaled score minus the passing score. That way they are calculating. So that formula they are giving on the website. Go with that. But the cutoff score is this, and then row score means what you achieve, and that convert into your scaled score. And if it is not 600, you are not clear the exam.
Okay, and I can find it on CAPR website, right?
Yes. Message me personally. I will forward the link.
Okay, thank you. And asking another question about study material in your class.
Study material, yes. So recordings, lectures, live lectures, all the like my PPTs that I'm gonna go for the reviews. Books already you have it. PPTs giving exactly like the books material, depending on the topics. That is all the materials are provided. Plus for the preparation question answers. So I
Okay,
believe in the question answers. So question answers, as much as you can solve the question answers, you get the idea that how to crack the questions and get the correct answer.
okay. And what about the mock tests?
2 mock test.
Okay.
Okay.
Thank you, ma'am.
You're welcome. PTA job, I got one question in the chat box. PTA job does not require any credential. You can easily get, there is no requirement. Or as long as you are a physiotherapist internationally, approach to the clinic, make a resume, upload it. If they require, they will hire. There is nothing PTA requirement for Canada. Any question?
Ma'am, what according to you, which province is better if you like wants to start like we want to be a future in physiotherapy, like Ontario, British Columbia, Quebec?
You are asking me the diplomatic.
Yeah, I know this is the
answer.
personal question, but as you tell you've been in Canada since 2014 and it's almost a 9 year.
10 years.
So I
Thank you,
think
10 years.
so. Yeah.
See, where you get the growth. So growth, see, Canada is, I feel like Canada is the most fruitful country for me. That's what I feel. Canada provides like those who are the hardworking and licensed holder. Okay, for them it is the best country. So your goal, your achievement is must. And the another thing is province wise, maximum population is with Ontario and British Columbia and Alberta. That is like the people where you get the peoples, you get the socialization, you get the your futures and everything. These are the good scores. Saskatchewan, Regina, personally, I am not in that province, so I have no idea about that thing. But they are also having a population, but limited versus the Ontario and the this one. So again, growth is depend where you get the job and not only job, professional as well as social. Both are good. You grow with the full colors.
I got you, man. Thank you, ma'am.
Yeah, so that's the main thing. So I hope I gave you the everyone's appropriate answers and your idea, rough idea about your preparation. So start your preparation. And for me, if I'm giving advice to enter in Canada is, I think it's easy rather than to become a successful person in Canada. Both has a different meaning. To see, Yura say he went 2 times in Canada. Okay. To enter in Canada, you get visitor visa, you get Canada, you can get student visa, you anything. Okay. To enter, yes, it's also hurdles, it's criteria and everything you have to fulfill, but you can achieve it. But to become a successful person, you need strong concrete stuff. And this is the most easy. I believe physiotherapy is the very best field where you can go with anywhere with the fly colors and you can go with your achievement. Success is always there. And with the short duration, like versus others is field, I can go physiotherapy, they validate their degree. You are eligible for the exam, clear your exam, you get your license. Speaking is easy. When you are in that roller coaster, you know the hardship. That is a different story. So I believe prepare yourself from your home country. Because home country, you are not with worried about your growth, you are worried about, see, when you are change the country, struggle to adjust the new environment. That is a different struggle. Where you have to adjust with the weather, you have to adjust with the another population, community. You have to adjust with the your financial burdens. You have to adjust with the odd jobs. If you are not license holder, you have to do the odd jobs. And after doing the 8 hours job, your mental concentration is very low to focus on your credential exams, license exams, I can say. So that consider this all stuff. So if as much as you can do from your home country is the best, then you can explore your another country because your hurdle, half of the hurdle is already done. Your license is already there. You can work as a licensed physiotherapist and remaining hours you can explore the country. So that is your another goal. So enter in a country and to get successful, to become a successful, both as a different synonyms. They are not equal. So consider this point, very important. I am like, even though you are a student of global physio or not, that is a different story. But if you are seeing this video and if you are enrolling, like if you are planning to go to the Canada as a physiotherapist, focus to get the license first. That is my only advice. Good. So see you guys. I will upload these lectures on the YouTube video as well. So you can go and search Global Physio Academy. My YouTube channel is there. You can also explore the things. You can contact me for the your written exam preparation. If credential, if you have some doubt, definitely feel free to ask me. I will give my guidance 100% as much as I can. Okay. Thank you.
Thank you, ma'am.
You're welcome.